Rising cases, looming winter weather, and the holiday season have health leaders stressing the importance of slowing the spread of the virus. Simple things like washing your hands, wearing a mask, and social distancing can have or make a huge difference. And recent news of a new COVID-19 vaccine is on the horizon. That's welcoming news. The drug trials that get those vaccines approved rely on volunteers who sign up to be guinea pigs. Our Roland Barris spoke to a local volunteer about what it's like to put your health on the line for the greater good.
Any story about vaccines really needs to begin with one undeniable fact.
The news of the vaccine should not get people to say that we don't need to continue to do the public health measures.
Eventually, a vaccine or several vaccines will arrive thanks to people like Kylie, who asked us to use just her first name.
And I saw the little ad come up that they needed volunteers. And for me, it was a total instinct thing. My gut just said, do it.
Kylie saw that ad for AstraZeneca on Facebook last summer. After reading 35 pages of trial information and undergoing health exams, she says the process was completely upfront.
I have a trust in science, so to me it didn't scare me the way I think it scares some people.
She says the first meeting took 3.5 hours. She had a full exam and 2 COVID tests before taking part. But she and a fellow participant never knew if they actually got the vaccine.
So we're comparing all the time. Like, does your arm still hurt? Mine does, stuff like that, which of course it doesn't even matter.
Someday she could find out if she got the vaccine if she wants. She says 80% of her friends call her brave. The other 20 say she's crazy. But Kylie says she just couldn't do nothing.
And as things are getting worse right now, and we're going into such a tricky season with people being indoors more, I'm just even more like, okay, if I can be a part of the solution here, let's do this, The
U.S. has agreed to buy 300 million doses of AstraZeneca's vaccine for $1.2 billion. Its effectiveness has not yet been determined. Roland Barris, Idaho News 6.